Lymphatic filaria affects over 120 million people in 72 countries.
We got a mission here.
Walking, the pain, swelling on the toes and everything. I had to stop working.
It's a mosquito or vector-borne disease. A mosquito can bite anyone.
We're on the trajectory of eliminating filaria.
I love the campaign. I love the elimination continuum.
This is Georgetown, capital of British Guiana. If these people were deprived of the use of their limbs, they would not only be denied much pleasure, but they could no longer tend their farms or make a living. That is why it is so important that they understand British Guiana's crippling disease, filaria.
For more than 1 century, we have been trying to curtail filaria in Guyana. And some of the reports coming out from the British, because of the level of science at the time, it was not very successful. But at least they tried. And we have been trying ever since.
Roughly in 2003, we started to do an assessment where they were looking really for this microfilaria, as we call it, a tiny worm, that these mosquitoes deposit into our blood. They found that roughly we had a 9.3% positivity rate. They were able to initiate a lot of steps, one of it being the deck salt.
You put salt in your food, and salt was one of the things that was being used in a broad way across the country. Had maybe 1 or 2 importers, and they had to comply by adding deck to the salt that was being distributed.
I've taken my pills this morning. They are very safe.
I hope you guys take your pills. That's all I ask you guys to do today.
We want to live in a country free from filaria, right?
Deck salt actually stands for diethyl carbamazine. It was really applied to your food, so when you would eat it, you would consume it. It would kill the microfilaria.
Nowadays, we don't see a lot of people with Bigfoot. And that is because of the previous campaigns that we've had, where we have been able to reduce the burden of infection in our population. That program was relatively successful.
The problem was that it was turning blue on the food due to manipulation and the heating. Of course, we had a little initial rejection, so they pivoted. They started to give it in a tablet form, the diethyl carbamazine and the albendazole, which everyone in Guyana knows as a worm tablet. Those were given in combination from 2016 to 2018. And it was done successfully in 2017 and 2018. The WHO came back to us. There were some new initiatives, the triple drug therapy, which is ivermectin, DEC, and albendazole. When they added those drugs, instead of 5 years, it reduced us to give these combined drugs for 2 years consecutively. 3 and 4 currently, we're giving that drug this year and next year, which is part of the WHO recommendation. The reason why they do it consecutively is because we're trying to maintain the threshold of coverage and protection. When the mosquitoes bite, there's not enough people that are infected to sustain transmission. In the South American context, Culex is the mosquito that spreads lymphatic filariasis. It bites me multiple times, and eventually, I should say, enough larvae that builds up in my blood. Those microfilaria will go to my peripheral blood. That's why people would say they're going for the night smear in Guyana, because the microfilaria only moves into the blood at night, especially the peripheral blood. And it's interesting because that's when the Culex mosquito will bite as well. The interesting thing about Culex mosquitoes and the context of filaria in Guyana, it really has a coastal distribution. It's an urban mosquito, so you find it in a lot of urban places. We find it in Region 3, it's in Region 4, and the mosquito is being eliminated.
We have made significant strides towards elimination campaign, and now we are down to only 2 regions that need mass drug administration so that they can also achieve the status of eliminating filaria as a public health problem within their region.
You should give yourself a big round of applause for that.
We had an extension that is currently ongoing, and we hope to complete that by mid-September.
We found that in Regions 3 and Regions 4, that we are a little bit above that 1%. We decided to go back and to do both of these regions so that we can be very confident that we are eliminating filaria. And that's where all of you come in. We want to implement it in a very timely manner by having at least 700 pill distributors already trained and ready to work. So you will all be going out in these 2 regions, and we want you to make sure that you reach as many persons as possible. We're spending a lot of money on this, both ourselves and PAHO, who have been generous in giving us a lot of resources to do this. We gotta walk every house, every street, and we gotta talk to people that want to know why is it that you come in and give them pills, although we have done this before. We must be patient.
I'm in the area sharing the pills.
We're getting good response, so we're hoping that everyone come out and take it as we go around.
Some persons are willing to take the pills, and we have some difficulties with some persons.
Some of them would say to you, I don't have Bigfoot. Why are you giving me the tablets? We need to explain that to people. And in a lot of cases, these symptoms like Bigfoot only manifest itself many, many years after you have been infected. And these parasites would have done a lot of damage to your lymphatic system. We gotta make sure that we arm ourselves with information pertaining to this disease so that we can explain that to the people who are going to be asking us questions.
I have learned so much so that I can able to enlighten my other colleagues, my friends, my family.
The pill is not anything dangerous or anything like that. It's just something that's there to help you.
It's not a deadly disease. The disease causes disability.
After a few years, it started to get ulcers on both legs. A large amount. Walking, standing up most times would swell it even more.
The first thing that probably happens is a dilation of that lymphatic system, and it just simply means it gets bigger. You will normally see the lymph around the lower legs, the arms, the breast.
The pain started from in the groin. It affected me a great lot, but still I do not think about it. I still keep moving on my foot, doing things what I have to do. Sometimes, if you start to walk a little too far, the foot will start to cramp. But I do a little exercise, and when it starts to cramp, I stop. I feel the muscles locking. And after the muscles lock, it ends up in more pain.
The stasis also causes bacterial infection to build up because the lymph can't flow in the body. And of course, it's a rich ground for the microorganisms to grow. Before an acute attack, the foot gets very hot, it starts to swell, it looks red. In the darker complexion persons, it gets darker, very sensitive to touch. In the worst case scenario, we have to give antibiotics.
So imagine moving from having a normal life with normal limbs. They're suffering, they cannot work to the capacity that they would want to work. In most cases, some of them can hardly walk.
Being accustomed to do everything on your own, I can't. You rely on persons or people to help you out because they cannot stand. Sometimes it's trigger the brain. You would get angry, you would behave in a manner where that, why this thing had to happen? Why me? But I have been learning to live with it.
You have to constantly clean your foot. You have to apply antibiotic or antifungal as needed. So just simple movements, because it could be painful. And then we ask them to wear appropriate shoes, because you know, the shoes me and you're wearing might be too tight. The foot becomes hard over time. That skin has been stretched so much and that fluid has built up that it becomes, unfortunately, prone to infection. Filaria only shows signs and symptoms after about 10 to 15 years. Some I may have been infected in my youth, and now when I'm about to be married or something at 40, I suddenly notice my limbs swelling. It's becoming irreversible. We can't turn back the hands of time. The lymphatic system is damaged. That's why we really encourage people to take the drugs.
I had filaria since I was 17 years old. I ended up in Davis Memorial Hospital with it. About 3 weeks, and then they sent me home. And after it started to affect me, like going to water or doing those things. When the rain fall, then it would act up, most times.
Apart from the leg being disfigured, apart from you can't move properly, because people used to look at people with big foot with a lot of scorn.
I am Cheryl Hopkinson. I'm the nurse, and I see patients on a daily basis. Public transportation treats them very bad. Because of their conditions, the taxis take even more from them. Some of the private taxis still do not want to take them. We see it every day here. The patients come, they tell us what goes on and how it affects them, financially, psychologically, and everything. Some persons, they cannot turn up because they do not have the means of getting here. One of my patients was telling me how difficult it was for her. When she got here, she was breathing short. She was sweaty and tired. She said she was on the road for hours just to get something to come here.
I think we've done very well informing persons of what the disease is, so that now we're having less of that stigma, but the fact that it's still there, we want to reach a point whereby no one affected with lymphatic filaria should have to suffer. We see patients that are affected. What we do there is try to alleviate their suffering and improve their quality of life. They apply antibiotic ointment. If they have any cut, scrapes, or bruise, or even interdigital and fungal infections, we demonstrate to them how they should daily care for the affected limb. So those are some of the things we do in our clinic. Of course, a lot of counseling concerning the disease and how to manage it. What really warms me is that persons, when they come to the clinic, they feel that they are in a space where they're free, they can communicate with any of the staff. If they need to be referred, we refer them to whatever other department they need to be referred to. They're already suffering from the disease. We don't want them to have to suffer from the stigma and discrimination attached to it.
My name is Rodwell Montigasque. I find one, my foot was swollen, right? Then after I got some treatment for it, and I'm still fit. I still dance. It don't stop my dancing. Reggae, soul, oldies. Love it. Love it. Love it. Reality, I love Bob Marley, reality. I don't allow any sickness to get me down. Yeah, I'm fit. As a fitter.
We're looking to have that elimination status by 2030. So we have up until then to put everything in place in order to get that done. And given that we only have 2 more regions to continue with for MDA, we can now shift our focus in equipping those facilities in other regions.
This is not a Ministry of Health effort. This is an effort for the country, because this country, the people of the country, is who would be benefiting from this. The last time that you had a global elimination of a disease was really smallpox. And the last case was sometime in the late 70s. We are on a trajectory of eliminating Filaria from Guyana. We'll be adding to the countries that remain in the world to eliminate Filaria. Other countries are trying. When you put the effort together, this can be another infectious disease that as a collective, a global collective, that we would have been able to eliminate.